Hello, 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 and welcome, welcome, welcome. Welcome, welcome, welcome to MedCognito Nclex. Are you ready for our review today? Today's review promises to be a wonderful one, an insightful one, and it's so needed for your Nclex exam. I am Dr. Julia, one of the tutors here at MedCognito Nclex. So send the link to a friend who will be writing the Nclex exam and invite them to come right in because today we are diving into an important topic that is a high yield for your Nclex, and that is Bell's palsy. So I am reaching out to you from Ontario, Canada. You can drop in the comment, let us know that you are in the room, and tell us where you are joining us from. We would always want to know, we would always want to connect with you as well. So send the link to a friend, invite them to come right in for this free Nclex review, and let's start right away. So I want to see in the comments, let us know where you are joining us from. So let's all get the link. Let me also get the link and share with everybody who has to be here. So get the link out there, share with a friend, tell them that we are starting the free Nclex review here at MedCognito Nclex, and we are discussing Bell's palsy. So kindly tap the link, share with a friend, tell them all to come into the room for this free review on Bell's palsy. So I'm waiting to see your comments. Let us know where you are joining us from. We would always want to connect with you. Right, I've also shared the link to all of our groups so that they will all come right in. So let's start right away. And remember that after this, I promise to give you a free mock exam on Bell's palsy. So stay with me right to the very end. So yes, 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 today is all about Bell's palsy. So we'll be going through key concepts for Bell's palsy, look at some nursing interventions, and then some case scenarios. So let me know that you are here. I've still not received your feedback. Let me know where you are joining in from. Would want to share the link to our MedCognito class so that all who are writing the Nclex exam, they can all join us. Yes, yes, yes. So let me share with the Nclex group. Yes, yes, we are there as well. So yes, all about Bell's palsy. An overview. So what is Bell's palsy? When you are asked, what is Bell's palsy? Okay, so Bell's palsy is a sudden onset of unilateral facial muscle weakness or paralysis. So you can even see from this image here that this client has muscle weakness, facial palsy on this side. And remember that it is linked to herpes simplex type 1 and then herpes zoster viruses. So in case you write in your exam and you meet this question as to which viruses or which organisms are linked to Bell's palsy, you can choose these: herpes simplex type 1 or herpes zoster virus. And note that 80% of clients recover fully within weeks 2 months. I hope you got that. So let's now dive into the pathophysiology. You may be wondering that what brings about this Bell's palsy. All right. So the nerve involved is cranial nerve 7. Cranial nerve 7, that is the facial nerve. So that is why you have all the symptoms happening on the face. So the facial nerve, which is cranial nerve 7, is involved. And yes, let me give you an Nclex tip here. If you are preparing for your Nclex, you should know the cranial nerves, all the 12 cranial nerves, and you should know their function. And if they are not functioning well, what will happen in the individual? That is an Nclex tip for you right there. So yes, Bell's palsy is caused by cranial nerve 7. What are some of the causes? Infection, trauma, hemorrhage, meningitis is a cause, and then we have tumors. So what's the mechanism? How does this really come about? So it's a lower motor neuron lesion, and then it will lead to the paralysis of the facial muscles. So, how would you know that this client has Bell's palsy? So, let's now run through the clinical features. So, this client comes in and says, over the past few days, I'm unable to close my eyelid. So, inability to close the eyelid. And then, since the facial muscles are weak, that client cannot wrinkle the forehead on that side. They cannot puff their cheeks because the muscle there is weak. Okay, so that is the first clinical feature to look out for. And then loss of taste. Loss of taste on the anterior two-thirds of the tongue on the affected side. So that is the function of the cranial nerve, the nerve 7, that is the facial nerve. So if it is paralyzed, then that client will not be able to close the eyelids on that side. That client cannot wrinkle the forehead on that side. That client cannot puff the cheeks because the muscle, the nerve is weak. There is paralysis of that nerve, and the muscles there are also weak. So there will be increased tearing on the affected side. So client is saying, I'm happy, I'm not sad, I don't want to cry, but I just have tears coming down on that side. And you should know the Bell phenomenon, the Bell's phenomenon. And what is the Bell's phenomenon? It is upward eye movement when closing the eye. So when the client starts to close the eye, then the eye will move upward. I hope you got the Bell phenomenon. If you got it, let me get a feedback in the chat box, some yes, 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 which will help me to know that you are right here with me. Let me know if you're on YouTube, if you're on Facebook, drop your yes. Let me know that you are good so we can continue because I want you to be able to answer any question that you will come across in your Nclex on Bell's palsy. Yes, so let me know if you are fine and let's continue right away. Thanks, thanks, thanks. Thanks for the feedback. All right, so as we do it here at MedCognito, we would always want to make the concept very easy for you. So I have this mnemonic for you to help you remember the clinical features for Bell's palsy. So I have the mnemonic Bell's P. So Bell's paralysis, Bell's palsy. Bell's P. So B for the blink reflex. E, client is coming with earache. The eye rolls up, as we talked about just a few minutes ago. Then the L, the lower corner of the mouth. So see, there's drooping at the lower corner of the mouth. Then the other L, there is loss of taste on the anterior two-thirds. And then brow movement. So clients cannot move because the muscles they are paralyzed. The nerve is not working. So it cannot wrinkle their forehead on that side. The S for a sudden onset. It occurs suddenly, hours to days. And then the P in our mnemonic Bell's P, the P is for unilateral paralysis. So for Bell's palsy, always remember that there is unilateral paralysis of the facial nerve, which is cranial nerve 7. And remember, I gave you an Nclex tip that you should know all the 12 cranial nerves, know their names, and know their function. And you should also be able to detect, okay, so if this client presents with drooping of the corner of the mouth, excessive tearing on one side, the client cannot wrinkle the forehead, you should be able to tell that, okay, there is a problem with facial nerve, that is cranial nerve 7. Great. So I hope you got our mnemonic. If you even should forget everything that I taught you today, you should not forget the mnemonic Bell's P. That helps you to remember the clinical features for Bell's palsy. So let's take a look at this image here. Just picture this when you see any question on Bell's palsy in your exam. See that the drooping eyebrow. So clients cannot even wrinkle this part of the forehead, the drooping eyelid. Then see the facial nerve supplying this side, which is paralyzed. And then there is drooping corner of the mouth. So never forget these clinical features. So it's very important to know differential diagnosis for Bell's palsy because there are some other conditions that may look so similar. They may be very similar to the presentation of Bell's palsy. But we're going to go through the differentials so that you will be able to differentiate all the other mimics of Bell's palsy. They may look like it, but it would not be Bell's palsy. So the first differential is stroke. The first differential is stroke. So how are you going to distinguish between Bell's palsy? So this client comes, there's drooping on the side of the mouth, and mostly what will come to mind is that this client has a stroke. So how are you going to differentiate that? For stroke, it affects both the upper and the lower face. And the client will have additional neurological deficits. So clients cannot even lift the arm. There is weak power in the arm, and that helps you. Clients cannot even walk because there is weakness on one half of the body. So that helps you to be able to distinguish between Bell's palsy and then actual stroke. Another differential is multiple sclerosis. But the catch here is that for multiple sclerosis, there are progressive neurological changes. So that should help you. And you should remember that Bell's palsy is so sudden, it happens suddenly. But multiple sclerosis is a kind of progressive, and you see the progressive nature of the neurological symptoms. Another differential is trigeminal neuralgia. Trigeminal neuralgia. So remember that for trigeminal neuralgia, the focus will be on pain. There will be pain on that side, and then there will be no muscle weakness. So this is a very important slide because you can get a case scenario. You have all the presentation, and you're supposed to pick what's the diagnosis here. Then you see stroke, you see multiple sclerosis, trigeminal neuralgia, and then you also see Bell's palsy, and you're wondering how am I going to choose because they all have weakness. This slide is going to help you to be able to differentiate all of the differentials. I hope you got it. Give me a thumbs up in the chat box. I want to connect. I want to know that you are here with me. I want to know that I'm communicating and that after this class, you will be able to answer any question on Bell's palsy. Give me your feedback in the chat box. If you're joining on Facebook, joining on YouTube, kindly give me a yes in the chat box. Great. All right, so let's move right on. So let me give you some more differences between stroke and then Bell's palsy. As I already told you, Bell's palsy is different from stroke. Bell's palsy is different from stroke, and it can cause weakness. Stroke can cause weakness in the arms and in the legs, on one side of the body or on the face. And always remember that Bell's palsy will not cause weakness in the arms or the legs, and it does not make it difficult to move the eye and to move the tongue. So please, this should help you to be able to distinguish stroke from Bell's palsy in any clinical scenario. So Bell's palsy wouldn't cause weakness in the arms and in the legs. So please remember this so you will be able to catch Bell's palsy in your exam. So let's look at this assessment. I have a mnemonic for you to make it easy. The client has come, you're suspecting Bell's palsy. How are you going to examine this client to be able to pick all the features that we have gone through? Use the COWS mnemonic. Use the COWS mnemonic. COWS. COWS. Someone put in the chat. COWS mnemonic. COWS. COWS. So close the eye for C. So client will close. So client, close your eye. So client will close the eye because you want to check for the weakness in the eyelid and in the eyebrow. So close your eyes. Then you examine. Open your eyes. You examine. Wrinkle your forehead. So you realize that there will be absence of wrinkle on that part of the paralysis where we have the Bell's palsy. So either it's on the right or the left, is unilateral palsy of the facial nerve. So you're going to have that side, the affected side, lacking wrinkle. So clients will not be able to wrinkle that part of the forehead. And then smile. And you can even see on this. So client will smile, and then you will notice the weak part of the face, which has been affected by the Bell's palsy. So always remember COWS mnemonic. Close eye, open eye, wrinkle forehead, and smile. I hope you got it. Let me get the feedback. Please, the feedback will mean so much to me. Let me get your feedback in the chat box. Give me some yes right there, and let's continue. Great. So I hope you are understanding it so far. So yes, so with a physical exam that we just did, so what are you supposed to look out for? You will see flaccid facial muscles. So there will be weakness of the facial muscle. There will be one-sided droop with inability to frown, inability to smile, inability to puff the cheeks. Because the muscles are weak, so the client cannot puff the cheeks. And the eye will remain open. So ask the client, close your eye, and that eye remains open. So, or there will be incomplete closure. So these are some subjective findings that you should take note of. Clients may complain of dry eye or excessive tearing, as I told you about. And then clients may also come with difficulty eating or drinking. So take note of these subjective findings that clients may report with. So with a nursing diagnosis, number one, risk of eye injury related to inability to close the eyelid. So that is very disturbing that clients cannot close the eye. So there is an increased risk of eye injury. Number two, body image disturbance due to the altered facial appearance. So look at this client. If this client is supposed to walk to work or walk around with it, you realize that people are like trying to figure out what's happening to her. So body image disturbances is an important aspect of Bell's palsy. And then number three, impaired oral health due to retention of food in the affected cheek, because that part of the muscle is weak. So client is not able to even puff the cheeks. So oral health will be impaired. So you should know all of these challenges for your clients with Bell's palsy so you can address all of them as a safe Nclex nurse. Great. So, in view of all the stuff that client will present, we have to intervene. So, eye protection. The client cannot close the eye. We have to help protect the eye. So, eye protection. We give artificial tears to prevent dryness, eye patch so that we use the eye patch at night. It helps to protect the eye. And then sunglasses. Sunglasses will help shield the eyes during the day. I hope you got that. Artificial tears, because the eyes are always open and sometimes it becomes so dry. So artificial tears will help prevent dryness. Eye patch used at night to protect the eye. And then sunglasses will shield the eyes during the day. Physical therapy. Yes, client has paralysis of that part of the face. So facial exercises, so crucial. Facial exercises will help prevent muscle atrophy and improve the tone. You should know that whenever there is a muscle, the muscle is not being used, it will atrophy. So the exercises are very important to put the muscle of the face in use so that it will prevent muscle atrophy and then improve the tone. I hope you got that. Then moist heat. This prevents stiffness. So it provides some comfort for the patient and then reduces stiffness. Gentle massage. So the gentle massage maintains the muscle elasticity. So I hope you got the point for physical therapy for Bell's palsy. Facial exercises preventing muscle atrophy and improving the tone. Moist heat, which provides comfort and reduces stiffness. And then a gentle massage, which maintains the muscle elasticity. Awesome, awesome. So, how are we going to treat this client with Bell's palsy? This client cannot close the eye. This client is having body image issues because the face is distorted. How are we going to help our client? The medications given include corticosteroids. Example, prednisone. So, prednisone will help reduce the nerve inflammation. It helps to reduce the nerve inflammation. And then we also give antivirals. Remember, right from the beginning of this class, I told you that some viruses can be implicated. That is, herpes zoster virus can be involved. So, giving antivirals will be super helpful. So, an example being is cyclovir, and this targets the potential virus that may be causing the Bell's palsy. Great. So let's move on to client teaching. We have to teach our client eye care because they cannot shut their eyes. Their eyes are getting dry and their eyes are prone to injury. So they should protect their eyes. Wear protective glasses when they are outdoors. They should use their artificial tears. Number 2, oral care. So they should chew on the unaffected side and then they should inspect the mouth for food debris. And this helps with their oral health. Number 3, they should protect from cold. They should use scarves to avoid the cold, or they should avoid the cold wind exposure. That is very important. So I hope you have noted all the points for client teaching. Eye care, number 1. Number 2, oral care, and then protecting themselves from the cold. So what's the prognosis? The client is worried. What was the prognosis for this Bell's palsy? The typical recovery will be weeks to months without residual effect. Weeks to months without residual effect. And then supportive care. Supportive care. So supportive care ensures faster recovery and prevents complications. I hope you got that. So you should be able to know the prognosis so you'll be able to educate your client. So with this slide, I want to point out to you some highly tested areas that you should know before you walk into the exam hall. Number one, eye protection and cornea safety is key for Bell's palsy. Never forget that. And then the need to use artificial tears and then eye patches. Number two, facial nerve stimulation. Facial nerve stimulation. So the exercises and the physical therapy helps with that. Number three, know the medications. The role of the corticosteroids, example prednisone, and the role of antivirals, how important they are in the management of Bell's palsy. And number four is very important. Do not overlook that the body image concerns of your client. So, counseling and then reassurance that it is temporary, it's going to go and you're going to get back your pretty face or your handsome face. So please, 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 the body image concerns should be addressed. You have to counsel your clients and reassure them. Are you good? Yes, we got to the end of our session for Bell's palsy, and I have some questions for us to go through to be able to test ourselves so we are sure that we got all that we have discussed. So remember these key points that Bell's palsy is unilateral facial paralysis, paralysis of the cranial nerve 7, known as the facial nerve. And I gave you that Nclex tip that do not walk into the exam hall and you don't have an idea of the 12 cranial nerves, you don't have an idea of their function, and you do not have an idea of what happens in the client when those nerves are not functioning properly. You should know that. So go learn all of that and write that in your notebook so you can revise that for your exam. So if you are good so far, give me the yes, 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 and let's dive right into our questions. Let me get your yes. Let me get your yes, yes before I continue. Let's look at some few questions, and I promise you that I have a free mock exam for you. So stay with me right to the very end. We have a free mock exam on Bell's palsy that I would love to share with you. So let's dive into these few questions before we finish up. Let's look at the first case scenario. Are you ready for it? Are you ready for it? Mrs. Taylor is a 45-year-old teacher and she reports with difficulty closing her right eye. And she has a droop on the right side of her face. Which intervention is the most critical? A. Encourage facial exercises. So even let's stop here. What do you think Mrs. Taylor has? What do you think Mrs. Taylor is presenting with? She cannot close the right eye. There is a droop on the right side of her face. Likely Bell's palsy. So which intervention is most critical? Encourage facial exercises, administer pain meds, C, protect the eye with artificial tears, and D, provide emotional support. The answer here is C. We need to protect her eye with artificial tears. That is very critical. So eye protection, as I told you, is critical to prevent corneal dryness and injuries. I hope you got this. So let's look at the next question. Case scenario 2. Mr. Johnson is 55-year-old farmer, has been diagnosed with Bell's palsy. He asked about the purpose of his prescribed prednisone and acyclovir. Do you remember I told you this? So, what will be your correct explanation? You're going to tell Mr. Johnson A. They reduce inflammation and fight potential viral infections. B. They manage the pain and improve your muscle tone. C. They will improve your blood flow and reduce your symptoms. D. They, they treat concurrent bacterial infections. Mhm. The answer here is A. The correct answer is A. Given the prednisone, the corticosteroids, and the antivirals will help reduce the inflammation. So corticosteroids will reduce the inflammation, and the antiviral will fight potential viral infections. Remember this. So yes, we got to the end of our session. I hope this session has been helpful to you, and now you are confident to answer any question on Bell's palsy that you will meet in your Nclex exam. Yes, that is how we do it here at MedCognito. We break down the concept, make it easy to understand and easy to remember, so you will get all your concepts needed for the exam and you will be able to pass your Nclex on your first attempt. That is our goal for you. And I have this good news for you. You have the opportunity to test yourself right in the comfort of your home, to put yourself in the exam mode. Because why do you present yourself for the exam on the actual day and you never rehearsed? You never prepared for exam. You never put yourself in the exam mode, although you have been studying. So we are giving you an opportunity to put yourself in the exam mode, to put yourself in the exam mode. So we have our mock exams for you. You can purchase our mock at only 29.99 Canadian dollars. That is that amount of money that you're using for your next ice cream or burger. Invest that in your Nclex exam. So you register, you choose which of the mocks that you would want to take. So either you want to take, okay, the high yield mock that would include a lot of topics in that mock. You're going to meet a lot of highly tested areas in that mock, and right after the mock you get your score, and then you get the answers, you get the rationales, and you can also request that we give you a breakdown of your performance, and it helps you to know your weak areas, to know your strengths. So from there, it helps you to know the areas that you should concentrate on in your preparations. And if you want to test yourself for Nclex pharmacology covers a huge chunk of the Nclex exam. So this is a beautiful opportunity. Purchase this mock and right in the comfort of your home on your laptop, you can test yourself and go through all the highly tested areas for Nclex pharmacology. This is so beautiful. So I'll put the link to get our mock right in the chat box so you can get it. Yes, 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 Her Excellency, good to have you here. Good to have you join us. So I'm putting the link for our mock, the paid one, at only 29.99 Canadian dollars. I'm going to put it right there in the chat box for you so you can purchase it and give yourself that opportunity to test yourself right in the comforts of your home. You should not present yourself for that day for your exam and you have not tested yourself. It's just like you want to win a marathon and you never practiced. You never practice, but you show up that day that you want to win the marathon. No, you have to put yourself in the marathon mode, be running around, and on that day, it will not even feel like it's a competition. You're going to go through the motions because you have prepared and you will win. So we want you to win as well. Put yourself in the exam mode, dive right into our mock 29.99 CAD, and you are good to go. Awesome. So let me share the next piece of information. So as we do it here, we break down concepts. We help you understand the concept so that you will be able to pass your NCLEX on your first attempt. So we throw that invitation to you right now to join the MedCognito NCLEX champions. Yes, we are the winning class. When you join our class, you get your specially crafted study planner. Our goal is that you cannot go on a journey and you have not planned. If you do not plan to win, you're planning to fail. If you do not plan, you're planning to fail. So you have this study planner which gives an overview of all that you're supposed to cover to be adequately prepared for the NCLEX exam. And day after day, you know what you are covering. So that if you have 6 months to prepare, you have your 6 month planner. If you have 3 months to prepare, you have your 3 month planner. And that helps you to know the journey ahead so that you do not wake up and you do not know what to do. You wake up every day knowing what you are going to study in preparation for your exam. That sounds so beautiful. And you have your study portal. There are over 500 short videos of highly tested areas, everything for NCLEX you find in your portal. That even as you are on the go, you're going about your duties, you're driving around, you're going for work, you can just plug it in and you're soaking the NCLEX content, empowering yourself up for success. That is beautiful. And we have workbooks attached to the videos that you can have the videos and then you go through your workbook. It helps you to understand all that you studied. There are questions on that topic. You answer them and it really tests you as to whether you really got the concept for that day. That is great. And you come to class twice a week to meet our amazing tutors who are there for you. You go through lots of questions from several angles on that topic for the day. You go through highly tested notes for that particular topic. That is so beautiful. And we have our NCLEX snapshots. We believe that it's always good to have an idea of what you're going to be taught in class. So before class, you have the snapshots for that day, and you go through it, and it gives you a fair idea of what you will be studying in class. So that when you come to class, understanding the concepts becomes so easy for you. And yes, it's always good to test yourself. So we do mock exams so that you will be able to test yourself day after day and be prepared to pass your NCLEX on your first attempt. And our bonus, which always excites me, is the mindset coaching. You can have all the content in there, but your thinking is telling you that, oh, this NCLEX I cannot pass, it's too difficult, it's too complex, there's so much to read. So you enter the exam hall already defeated. So we believe in working on your mindset because your mindset makes you. If you think success, you will have success. If you think failure, failure will be your portion. So we help you that apart from the content, we add on that great mindset, that powerful mindset which helps you to face the exam confidently, knowing that you are going to pass on your first attempt. So that is why we want you to join us because we want you to be a part of our class and we want to be a part of your success story. So you have access to all of these in your portal. You always have the the replays after the live classes. In case you should make class due to your schedule, you will be able to see the replay right in your portal. You have all the notes you have to cover for NCLEX, and this is beautiful. We do higher reviews, we go through highly tested areas, and these lectures help you to do a quick revision when you're about to go for your exam. We cover all the systems, all that you're supposed to cover for NCLEX. We got you. MedCognito NCLEX has got you. So that is why we are inviting you to join us. We give you mind boosters as well. And this is a review from one of our students that is being great. She's gathering the courage, she's gathering a lot of knowledge, and she knows that she will pass on her first attempt. That is the goal that we have for you as well. Amazing review from our class. So what will be the investment for this? For a 1 month plan with us, 199 Canadian dollars. It is worth the investment. I'm going to drop the links if you want to join our class. We're starting the next cohort of classes soon, and we want you to join the winning class. The 30-day plan for 199 CAD. And if you feel that I really love the classes, I really love how you are breaking down concepts, I want to go on the journey with you for 6 months. Okay, you got this cool deal of 997 CAD. And the good news is that you will have a flexible payment plan. You can break it down into 2, 3, 4, 5, 6. You can pay it monthly, you can pay 2 monthly, 3 monthly, 4, 5, and you can pay it every month for 6 times. 997 Canadian dollars. So let me drop the link right now so that those who are ready to dive into our winning class can register right away. And yes, we have a free Nclex group as well. Let me drop that too. We have a free Facebook group. I'll be dropping all of that so you can join us. The WhatsApp group is free. You can join if you want to have quick updates whenever we are having class. So do join. So let me give you the 6-month plan and the 1-month plan. No overthinking. You deserve the right program that will help you to save time. You deserve the right program that will give you the high yield points, the high yield content that you need to pass your Nclex on your first attempt. And that's exactly what we are here to help you to do. So you can join our free Facebook group here as well. And I'm going to drop the WhatsApp group for quick updates. And I promise to share a free mock exam on Bell's Palsy with you. So stay right here with me. Do not go anywhere. I'll stick to my promise. I will share a free mock exam on Bell's Palsy because from today, I want you to be able to answer any question on Bell's Palsy. All right, so please do join our class. We can't wait to have you in class and we can't wait to be a part of your success story. So let me share the free mock exam with you now. Well done for staying through to the very end. Okay, here you go. Giving you the free mock. Free mock Bell's Palsy. Great. So yes, I've dropped the free mock for you. You can dive into it right now. Answer all the questions in that mock on Bell's Palsy. And I bet you from today you will be able to answer any question on Bell's Palsy that you will encounter in your exam. So tap the link and join us in class. We can't wait to be a part of your success story. And in case you need any further information, reach us on our email at medcognitoclass@gmail.com, and we will be there to assist you to get our mocks. Our paid mocks are 29.99 Canadian dollars. If you want a 1-month subscription for 199 CAD, If you want the 6 month plan for only 997 Canadian dollars, you are worth every investment. You deserve to pass your Nclex on your first attempt. And that is what we here at MedCognito are here to help you do. So see you in class and keep studying one day at a time. All the hard work will surely pay off. So do not get discouraged. So till I come your way again, it's been Dr. Julia, your tutor for today. Bye bye and stay blessed.